Again, welcome all. My name is Andrew Hone, President and CEO of the Portland Business Alliance. Thanks so much for joining us. Thank you to our members and to our colleagues across the region and the state. And thank you to the leadership of OHSU for joining us today. We have been very fortunate to have great directors on our board from OHSU, Connie Seeley previously, and now Abby Tibbs. So we are appreciative of the relationship. Thank you to our counterparts of Kate Natoli, Valerie Cuevas at OHSU for supporting the gathering today. And we are doing this in partnership with our colleagues at Oregon Restaurant and Lodging Association and the Portland Lodging Association. So Jason Brandt and your team, we really appreciate the partnership and all that you do. Additionally, we have joined with Travel Portland to Jeff Miller, to his incredible team. Thank you for working with us today. And of course, to my team member, Ashley O'Dill, thank you for setting up this gathering. And we have been aware of COVID-19 and under intense public health focus since March of 2020. It's hard to believe, but it has been that long. And with the advent of the vaccine and a vastly greatly reduced caseloads in April and May of this year, we were all grateful for what appeared to be a rapidly waning outbreak and pandemic. And yes, with the Delta variant now spiking caseloads and straining ICUs and health services in general, mortality rising, we are here again and witnessing our regional and state health systems strained and our frontline providers overwhelmed. The business community has been resilient and worked remarkably to support the efforts to contain the virus, and know that the collaborations that we have with our public health officials, of course, with our leaders in the health systems, that we can save lives and we can beat this thing. So we will get a presentation by our guests today, but I highly encourage all of you to populate questions into the chat function. I'm going to read the names of all of our guests today that are joining us. We'll have a lead off by President Dr. Jacobs, and then some great additions to give deeper dive analysis. So let me just start by reading all the names of the great guests we have. Dr. Danny Jacobs, President of Oregon Health and Science. Dr. Renee Edwards, Senior Vice President and Chief Medical Officer. Dr. Don Nolt, Professor of Pediatrics and Division of Infectious Disease. And Dr. Graven, the Director of the Office of Advanced Analytics. And with that, and without further ado, Dr. Jacobs, welcome. Thanks for joining us today, and the floor is all yours.
Thank you, and thanks to everyone for attending this meeting. I think your presence today and attention to this issue demonstrates, as you heard already, the severity of what we're currently facing as hospitals, health systems, and also as community members. So as you know, Oregon has reached a point in the pandemic that we worked so hard to avoid. I don't think it's an overstatement to say that things are worse now than they've ever been. This is certainly not news any of us wants to hear, and we certainly realize the impact the pandemic has had on the business community and tourism to our state. So please know that we don't take our recommendations lightly. We know that so many are faced with difficult decisions that may continue to stress and strain our organizations, our family, our friends, our loved ones, and our communities. But as Oregon's Academic Health Center, we want to share with you our deep concerns about the days to come and the challenges we are already facing to meet our mission to serve Oregonians across the state. We also, as you heard, want to make sure we have time for you to ask our experts questions about the Delta variant or the vaccines or masking or safety in schools or other pandemic topics that are top of mind for you. But to put it bluntly, Oregon's hospitals are in crisis. And this includes OHSU. And we want to be certain that everyone understands that this is putting the health of Oregonians everywhere at risk. Again, as you've heard, the Delta variant is racing through our communities at a speed and with an impact that we haven't seen before. And just like we've seen throughout this pandemic, it's also impacting our BIPOC communities more severely. So we forecast, OHSU forecast, that the next month or two are going to be the most challenging yet of the pandemic for Oregonians who need access to a hospital bed. For anything, including accidents, injury, heart attacks, or other diseases. Dr. Graven has shared some of this information publicly last week, and his estimates and analytics suggest that we will be at least 500 beds short of the projected need in early September. He continues to update his forecast regularly, and this projection still holds true. And in fact, his modeling tracks very closely and is tracking very closely to the actual hospitalization numbers as he compares the data from week to week. The stories we're hearing from hospitals around the state and in our own intensive care unit brings to life the dire situation in which we find ourselves. Dr. Edwards, our Chief Medical Officer, will describe this for us. And we will also hear from Dr. Note, an infectious disease expert, where unvaccinated organs and vaccinated organs to a much smaller extent, so unvaccinated Oregonians and vaccinated Oregonians to a much smaller extent, are infecting their friends, family, and children who are not yet eligible to get vaccinated. So our healthcare system is severely strained, and I want to underscore again that our ability to care for patients with and without COVID-19 will be increasingly impeded. The nature of the Delta variant and its rate of spread makes some of the devastating impacts inevitable, no matter what we do. But we can still slow the spread and give our hospitals time. So masks, keeping our distance, limiting gatherings, staying outdoors when gathering if you must gather with others, all work to slow the spread of the virus. So as business leaders and leaders in your own communities, we need your help to encourage more Oregonians and visitors to Oregon to heed these public health prevention measures. At OHSU, we announced last week that we will extend our modified operations through December 17. That means that only critical function employees will be on campus. Those who can telework will be required to continue teleworking. We're also restricting in-person events that are not business critical until January 2022. And at this time, we expect our in-person classes will resume in the fall, but all will follow masking guidance and the other strict safety protocols that I mentioned earlier and that are out from experts around the nation. Now, of course, we will be reevaluating our situation and these decisions regularly, and we will make any and all adjustments as needed. But at this time, we believe that this is what we need to do to slow the spread. And certainly we appreciate your partnership as we collectively face the challenges ahead. I'll now turn it over to Dr. Graven, our lead data scientist, to discuss Oregon's current COVID-19 forecast. Thank you.
Thank you, President Jacobs. I'm going to go ahead and share a screen with some data, essentially a forecast brief that I come out with, and I'm going to share those, and then hopefully we'll get through that quickly. I think you know the situation is bad, and then we have Dr. Edwards and Dr. Nolt to help think about what are some actions we could be taking. All right. For those you don't know, I've been producing a forecast every week, and the main metric that I track is the total number of COVID positive patients in any hospital in Oregon. And you'll see here in the screen that the red line is that number, and it's been shooting up very fast, the fastest rate we've ever seen of increase. And it's now reached a point much higher than we've had at other points in the surge. As of yesterday, our census was 937, and you can see that's well above where we've been. The reality is, this surge is entirely driven by the Delta variant. I think there's good calculations. You can see that, with our previous immunity level, we would have had maybe a minor surge as we opened up, but with the Delta variant, everything changed. Regionally, you can see here that we have, I'm producing the number of patients per capita in each of our regions. So you can kind of look into your area and see what's going on. And the bad news is all regions are well above where they've ever been in terms of the fall or winter peak. And there's a couple regions 3, 5, and 7, basically all of Southern Oregon, who are in dramatically higher levels, sometimes 2, 3, or even 4 times higher than the rest of the state. Certainly no hospital could ever be prepared for that. And of course, you're seeing that in the news. Around the country, we're also seeing peaks. It's not just in Oregon. And you'll see big increases in the South, the Midwest, and in the West. And you'll see down at the bottom is the Northeast. And I mentioned this one because the Northeast has a very high vaccination rate. And you can see their surge, while they are having an increase right now, it's much more manageable than the surge we're experiencing. The critical resource that we try to track is the ICU. And so here I'm showing you the percent of ICU beds that are still that are available. This chart's got two versions of data, some old, some new. I'm going to take you to the table on the upper right, and you'll see on right now 41% of our occupied ICU beds have COVID patients in them. That's broken down across the other regions. You can see in region 5, that number is 73%. Region 3, it's 70%, and region 7, it's climbing to 46%. So no region is being spared. Region 1 is actually performing the best. However, because we provide so many services for the rest of the state, even that 28% can mean that we are unable to perform additional procedures. So this is the ICU. What are the behaviors that are been highly correlated with the surges we've had? I'm showing you some of the ones that we are able to track using surveys that are on Facebook. These are updated pretty regularly. And the 4 critical behaviors I see that are measured well are shopping indoors, time with other indoors. That's time with others, not in your household. Restaurant indoors, not outdoors, and large event indoors. And you can see all these have responded at different times to different policy actions. And they've been highly correlated with stemming the spread. Most recently, you can see 3 of them are declining to levels that are lower than recent, but not as low as we've had at different points during the pandemic. That includes time with others indoors, restaurant indoors, and large events indoors. The other critical piece is mask wearing. So mask wearing, of course, if you're indoors and you're wearing a mask, that's great. And what we've seen in Oregon is our mask wearing rate had been around 90% and declined during the reduction in recommendations down to a point of 32%. And then what you'll see is it's been steadily increasing since then. As of this morning, I pulled data from, I guess, 2 days ago or yesterday, and it's at 75%. Now, I believe that we really need this level to be above 80% before we would really be truly effective with the mask mandate. And therefore, I think we still have a ways to go before we expect this to be super useful. And most critically important, we want the whole population to wear a mask, but it's most important if the unvaccinated are wearing masks. So if there's still 25% left, but they're all unvaccinated, the policy is not going to be nearly as strong or effective. So here I'm showing you the forecast. There's a lot of assumptions that go into this, but those all come out in my weekly brief that are publicly available. And what you can see here is we're steadily climbing on a path. Now I do expect us to see a peak, but of course this peak is at 1,075 beds on September 3rd. That's well above the number of beds we have available for this sort of health service. And while it's coming soon, the pain from it is going to be with us for quite a while. If a more manageable number of beds is probably around 300. We can probably handle that in the state without having a lot of discomfort. And that's not until, by this forecast, until the middle of October or towards the end. So we really are still looking at 2 months of extreme situations in our hospitals, regardless of whether or not we hit this peak. And I'll admit, this is modeling. There's assumptions. I'm trying to do my best, but it could go above that peak. It could last longer. And so the clear information here is that we have a major problem, and we're needing all the help we can get. I have overlaid some of the interventions that we've done previously, and the good news is these have been effective. The stay home campaign, the mask mandate from last summer, the freeze in the fall and winter, and then the back to extreme period all nipped different surges. And so we're hoping to see that happen soon. Whether or not the mask mandate was enough, we should see the impacts beginning this week, hopefully with a peak in cases, and then begin to see a peak in the census next week. But if it's really not been very effective, we may see this climb further. Finally, as Dr. Jacobs said, the people that we have in the hospital, it does not hit all of our community equally. And so I'm showing you here that once you adjust for age, which is really important when you make an analysis like this to compare different races or ethnicities, because they're not all have the same age profile. You can see that the American Indian and Alaska Native have 3.5 times as many hospitalizations as whites. For Blacks, that's 3.4, for Pacific Islanders, 8.2, and for Hispanic, that's 3.3. So while we're not seeing their case counts or their hospitalizations maybe being as high, but once you adjust for the age, you really shouldn't expect hardly anyone, and we are seeing that. So of course, it's not affecting all our communities the same. I'm going to go ahead and pause here and go ahead and let Dr. Edwards explain the situation that she's seeing as Chief Medical Officer.
Thanks so much, Dr. Gravid. Excuse me. Good morning, everyone. My name is Renee Edwards, and I serve as the Chief Medical Officer at OHSU. And I want to echo Dr. Jacobs that we're incredibly grateful that you've all joined us here today to listen to the message that we have for you. We recognize the tremendous challenges that COVID-19 has placed on Oregon businesses throughout the pandemic. And we know that you too are carefully managing through this fifth surge. But it's my job and my desire to help the thousands of dedicated healthcare providers here at OHSU provide safe, high-quality care to every Oregonian who needs us. But I'll be blunt, we can't do that right now, and it's truly devastating to us all. And from what I hear and know from my colleagues around Oregon, the situation across the state is frankly dire at this time. I've been a physician for more than 30 years and with over 20 of those here at OHSU. And I've never before experienced the level of crisis that Oregonians are currently facing. Hospitals across our state are at their fullest capacities, and many, if not most, are frankly beyond their tipping point, especially in Southern and Eastern Oregon. We are seeing a continued drastic increase in patients hospitalized due to COVID-19, as Dr. Graven's presentation illustrates. And today there are 937 COVID-19 positive patients in Oregon hospitals. 253 of these are in ICUs, and of those, 146 are on ventilators. Last week, I warned that a quarter of OHSU's ICU capacity was being taken up by COVID patients. And now this week, the number of COVID patients has grown to fully 1/3 of our ICU capacity. All but one of these individuals are unvaccinated, and many are under the age of 50. The large majority of our ICU COVID patients are on a ventilator, and it's unheard of for a single disease to strike such a significant percentage of our ICU patients. And yet that's what we're seeing at this time. What's making this situation exponentially worse is the precarious position we were already in before this surge took hold. Oregon's hospitals and clinics were already experiencing a high volume of seriously ill patients who don't have COVID, including those who had delayed care during the past year due to the pandemic. And as such, they were coming to us sicker and requiring longer hospital stays. All of these patients, the folks that we were seeing pre-surge and those now in this COVID surge, continue to need our care. And there's not enough hospital beds for them. OHSU is just one of 2 level 1 trauma centers in the state, and we're currently operating at our fullest capacity based upon our available staffing. And again, this is true for almost every hospital in Oregon. Our emergency department, like others, is bursting at the seams, and patients who arrive to our ED may be waiting hours to receive needed care, or sometimes even days for placement into a hospital bed. We are doing everything we can to accommodate their needs without compromising quality of care. But frankly, it's becoming more difficult, exhausting, and frustrating. I cannot thank enough our healthcare workers who've dedicated 18 months of significant personal effort and energy to this pandemic. They are true heroes. OHSU's ability to receive patient transfers from other hospitals is also increasingly limited and now reserved only for the sickest patients who require life-saving care for any condition. Last week, we learned of a patient who needed a ventilator and dialysis and was dying in an emergency department in Eastern Oregon. No other hospital could take them because everyone was reporting that they were full. So OHSU made a commitment to take the patient as an ED to ED transfer, because even though we also did not have an ICU bed at that moment, we knew we could staff to a higher level of care for this patient in our emergency department than they were capable of doing in Eastern Oregon. So at this moment, the only way that a severely sick or injured Oregonian will obtain a hospital bed in the state is if someone else gives one up. OHSU and other hospitals are doing what we can. We're certainly increasing the level of statewide hospital coordination, especially for the sickest Oregonians. And over the weekend, we began creating a statewide centralized transfer system to appropriately place critically ill patients. We're working with state and federal partners to determine what resources, including staffing, may be available to assist with this crisis. And we're significantly reducing our inpatient surgical cases by placing a cap on the total number of surgeries that can be done per day. However, at the speed that this Delta variant spreads, as Dr. Graven demonstrated, this is not enough to ensure that every Oregonian gets the care they need. Some will wait too long, and some will be unable to get a hospital bed before it's too late. So as I said at the beginning, this is a devastating situation we find ourselves in, but we will persevere with your help. We all want life to return to normal, and if we all do our part, it will make a difference. We especially urge those who are unvaccinated to stay home at this time and not put themselves or others in our communities at risk. And now I'm going to pass this over to Dr. Dawn Nolt, who's going to further speak to additional actions that we as Oregonians must continue to take to attempt to flatten this curve. Dr. Nolt.
Thank you, Dr. Edwards. My name is Dawn Nolt. I'm one of OHSU's lead infectious disease specialists. I'm a professor of pediatrics and infectious diseases at Dornbecker, which is our children's hospital here at OHSU. So as Dr. Edwards noted, our hospitals are overwhelmed due to the rapid spread of the Delta variant racing through our communities. And in addition to the sobering statistics shared by Dr. Graven and Dr. Edwards, severely ill adult patients are also at times being cared for in our pediatric wards. This is quite disconcerting to everyone, but it shows that our adult hospitals are full. And the Children's Hospital at OHSU Dornbecker could next be challenged to provide care for children who need it in Oregon. So as Dr. Graven mentioned, the Delta variant has really changed this war in terms of the COVID-19 pandemic. Whereas in the beginning, COVID-19 was spread to 4 people from 1 infected person, the Delta variant is much more contagious and now is able to spread to 8 to 12 cases from the initial index case. So I know this news and this information is extremely difficult for everyone, especially as Oregonians have made such progress against COVID-19 earlier this year. It really felt like we were nearing the end of that tunnel with that bright light, and now that light is much more dim. The news about the surge is also especially hard, given that schools are on the cusp of opening to in-person learning. I know this personally, how hard this is. I have a 13-year-old at home who really can't wait to be in school, to be with their friends again this year. So as a pediatrician, an infectious disease doctor, and a mother, I'm here to emphasize that in-person schooling is essential for our child's physical and mental health. And we must all collectively as a community really prioritize our kids and their emotional, social, and educational well-being. We need to do our part to slow the spread of this Delta variant and really give our schools and our kids a chance. But the good news is we know what needs to be done. Getting vaccinated is the single best thing a person can do to prevent severe sickness and death from COVID-19 and the Delta variant. So if you know someone who's not yet vaccinated and they're eligible to do so, please encourage them to not delay getting vaccinated. It does take 2 weeks after the second dose of the vaccine to be fully protected against the virus. So while vaccination is a critical tool in our ability to win this war, it's not going to affect the outcome of this battle we're certainly in, the battle of the COVID-19 Delta variant. but vaccinations is critical to blunt the force of the next variants. So for this current battle against Delta, Oregonians and visitors to Oregon, regardless of whether or not they receive the vaccine, should wear masks and be thoughtful as possible about the need for community interactions and gatherings. If they must interact with those outside their household, regardless of vaccination status, Oregonians and visitors to our state should wear a mask, physically distance, and stay outdoors for these interactions. And while the vaccine is very safe and effective against severe cases of COVID-19, there's still a chance, and as Dr. Jacobs noted, a small chance, but there is a chance that a vaccinated person can become infected and spread that virus to others at the same rate as an unvaccinated person. So OHSU is asking Oregonians and visitors to Oregon to consider the safety of your activities, to limit the possibility of the need for hospital care for trauma and other injuries. As Dr. Edwards says, and we know on the ground level, our hospitals are overflowing and we need your help. We recognize this is hard and tiring. Every mask, every vaccine, and every attempt to limit gathering is important. We are hoping you can help us carry this key message to Oregonians and visitors to our state. Please ask them to take personal responsibility and do their part for our communities and for our kids. You are leaders in your respective communities, and what you say and what you do matters. And we really appreciate your time today. We're now happy to take any questions you may have.
Appreciate this sobering, obviously, but very effective presentation from all of you. And I want to get right into the questions and just to continue to encourage people to submit their questions to the Q&A function. I already see a note about getting the slides that were shared out today. I'm sure we can transmit those to everybody, not infectiously, but just through regular old internet. So I want to start really with the specificity of children. I think it's actually very apropos because Dr. Nold, I think your expertise is in this, but obviously this is open to everybody to answer and would appreciate all of you chiming in at any point in time. So I see Tricia has a question about specifically children. So is it true that children under 12 who can't be vaccinated presently are experiencing more severe symptoms with the Delta variant, or are children just testing positive more now because the Delta variant spreads more easily? And then I just want to flank in, just for everyone to be aware, can you give us a sense of when we might see clearance for vaccinations for that 6 to 12-year-old range? As you noted, very specifically, we have in-person learning, the advent of that coming forward. So I think a lot of people will be curious about that. So sorry for the two-part question, but the first from Tricia, and then secondly, when can we expect these the vaccination approvals for kids 6 through 12?
Right, thank you so much. And Tricia, thank you for that question. Certainly one that I've got an answer to, though the answer often changes at least week to week. So pre-Delta, we felt that children who are obviously able to get infected and become very sick and able to transmit were not as much so compared to adults. And so what we were feeling was that this increase that we're seeing around the country of kids being hospitalized in an ICU was really only because there's just so many more kids were being infected because the Delta variant is so contagious. I'm hearing from experts that perhaps there will be data coming in that overall the Delta variant seems to cause more severe disease in those who are infected, including kids, but the final word on that is not out. But I think it's important to know, at least for the safety of our kids, that they get infected from adults. And if you want to be around children, please protect yourself against COVID so that you can take care of yourself and you can take care of the kids who can't be vaccinated. And the other question, my crystal ball, which changes again every week, is that the FDA and the CDC, who have a lot of pediatricians on their panels, and so are always interested in promoting safety of vaccinations, has really asked for a larger number of kids to be enrolled and to have a longer safety surveillance. So with adults, it was 2 months after the vaccine doses. Now it's 4 months or so. projected, and this is really based on some expert colleagues as well as what's in the lay press, we think that maybe Pfizer will come out with some, well, they'll apply for authorization probably in late fall. And then under that, so that's the 5 to 11-year-old, probably late fall that we might ask for and see authorization. And then younger than that will be early next year. So our kids are going to go into school, younger kids under 12 years will go into school unvaccinated. So it's super important that we do all the things we can, which includes vaccination and masking.
Thanks for that. And I know you actually just answered another question from Stumptown DJs, who was curious about that very infant age group, of which I have 3 children in that category. So I appreciate the answer. And I do want to head back up now towards a question from our partner, Jeff Miller, who leads Up Travel Portland. It's good to see you here, Jeff. Thanks for the question. And this is getting back perhaps more broadly to public policy. And he's asking the question, what chances do you see of limiting meetings and conventions of any size gatherings?
Well, we know that works. We've done limits as a mitigation factor early in the pandemic. We have limited capacity. I would say that we are in a worse situation than we were earlier. And I think that limits on capacity would be very effective in this surge. But I don't make the rules for Oregon. But I do think that it would be very effective.
And I think there's an important comment then for, given that we don't make the rules for Oregon and can't comment on whether large conventions and gatherings will be limited, we would strongly encourage you, if you are in attendance at those events, to wear a mask and do your best to physically distance. And although outdoors is always preferable to indoors, if you're at a large event outdoors, particularly where it may be more difficult to distance due to the number of people who are present, please also wear a mask outside.
Great commentary about the difference of outdoor and indoor. And I actually want to shift now to a question from our friends over at the Central East Side Industrial Council. We hope you're doing well. I can actually see you out the window here. So if you are vaccinated, this gets down to the really question of indoor, outdoor. Is it safe to be indoors with other people who are also vaccinated? Or should people be establishing the pods that I think everybody was aware of, especially when childcare and school were completely inoperable for a time last year? So is it safe to be indoors with others who are also vaccinated, or do we need to be establishing these pod concepts again, or both?
So I confess I haven't looked at the latest CDC recommendations which change, but I don't know if they've changed with Delta. I think that you need to be careful congregating indoors with people who are not in your household, even if they are vaccinated. And so I would really think about that and see if you would want to accept that risk. It's a low risk. It could be better if you're outdoors, but it is a risk, knowing that we have seen vaccine breakthroughs of those people.
Yeah, and I can chime in that, the reality is our hospital systems, we could have handled a load from vaccinated people very occasionally getting sick, following all the rules, but the demand we're having right now is from the unvaccinated community. That's what's really filling the hospital. Oh, my connection might be a little light here.
We heard you, Peter. Excellent answer as always.
Absolutely. And now I want to shift. I see one that came in through the chat function. So I just want to give a shout out to Gwen Baldwin, who had asked this question. So given the higher infectious rate, is there an update on the distance? The 6-foot marker was what we broadly heard about. Is that still the standard, or what should we know about physical distancing with these higher infection rates that you mentioned?
I have not heard any kind of an update to the 6 feet mark. I'm seeing some hesitancy in Dr. Nolt's face, and I think it's because She's thinking about the increased infectious risk
Right.
with the Delta variant
Mhm.
and the, frankly, throughout the pandemic, one of our big questions has been, to what extent is this virus airborne?
Mhm.
To what extent can it spread? And that's highly dependent upon things like, are you a soft talker or a loud talker? Are you laughing or singing? Are you sneezing? And so when we get into those fine details, how far something can be transmitted varies. I think the 6-foot mark is still what we're all working with, particularly if you're masked. But do be mindful that if there's the opportunity for additional distance, that's never going to hurt.
Great. Appreciate the answer. And then here's one, I think we've all been, I know everyone's been watching the headlines similarly around the Delta variant, but let's talk about the vaccines themselves, because we heard about the idea of a booster shot, about the duration of immunity. And I see a question from Kevin Johnson. Thanks for the question, Kevin. So how long do you estimate, or do we know with any certainty about the effectiveness of the current vaccines, especially that we have sort of two that are in similar nature, which are Pfizer and Moderna, and then a Johnson & Johnson one. And I think there's been questions about the difference in durability with those two different types of vaccines. So how long do we know that the vaccines currently last? And then part two of Kevin's question is, we're seeing the Delta variant. We knew it was coming. It's now impacted our systems here significantly. And now we're hearing rumors of something coming out of Peru. And what are your estimations there? So question one on the effectiveness and durability of the vaccines, and then two, this new Peru variant that we're hearing about.
I think we're working on the assumption that, which I think is a good assumption, that the vaccines against the current variants, including the Delta variants, is still quite good. I think that the sheer number of cases of the Delta variant is pushing this question more to the forefront of public health. But so far, what we want to say, and this has been very clear from the FDA and the CDC, is that the 2 doses of the mRNA and the 1 dose of the J&J will provide you protection against serious disease and hospitalization. There is an added benefit, and we will see that data once it's presented to the FDA and the CDC, hopefully in the next week or so. But we want to assure people that if you're vaccinated, with 1 or 2 doses, that's the main foundation for protection against any variant. Oh, and then other variants, okay. Boy, so variants come and go. Like COVID-19 replicates, it's its job to mutate and to have variants. And some variants will dissipate very quickly, and some variants will take hold. And we worry about the ones that will take hold. And they could be more contagious. They could cause increased disease. And so we just don't know, but we will have variants coming down the pipeline. What helps to decrease variants emerging is to reduce the total number of virus in the community. So if you have an entire state that's uniformly vaccinated, very little virus will emerge to then be mutated. If you have pockets of unvaccinated areas, those are the likelihood of where variants would come from. So it's so important to vaccinate as much as you can across as many geographic regions as you can.
Let's talk a few things, just real tactical questions on vaccinated teens. I'm seeing this as interesting. I think we can always sort of know the answers as well as when to time the booster shots. I'm going to do a twofer here. So starting with Nicole Dorfman. So should vaccinated teens be required to wear masks when they're in a car together or hanging out in someone's home? So what about these teenagers? How do you work with teenagers? I mean, this is the quintessential rebellious group, right? And so how do we talk with teenagers about wearing masks indoors when they are vaccinated? And then I want to flank that with Shannon, who's asking about timing for a booster shot when you're compromised, but marginally, which I think is a fascinating, it gets into this gray area. So a 2-part question. What do we do with teenagers indoors, hanging out, who are vaccinated? Should they be wearing masks? And then what about this 3rd booster shot, timing it when you have some sort of compromise, but marginally so? Sorry to throw that doubly at you.
Does anyone else want to pick up how to behaviorally modify a teenager? I mean, it's hard, teenagers, a couple things. Teenagers, when you look at the transmission rate, are very close to adults. They have the ability to get infected, to get the same level of disease, and able to transmit almost as effectively as adults. And also teenagers really like to hang out. They have very close contacts. And so if they're unvaccinated at this point in the pandemic, they're at very high risk to get infected. This is the worst time in the pandemic, I think, to be an unvaccinated teenager. So I'd really, really hope that if they want to get together, that they really wear masks and physically distance. They're also social media savvy, so maybe encourage that. We don't want them to have so much screen time, but that may be something to really continue to foster interactions through social media. Peter and Ed and Renee, or any thoughts?
Yeah, I mean, I think, I'm just, focused on our hospital census right now. I think we're going to see more increases in the news today. I think that we are, unfortunately, it's not teens that are getting hospitalized. So, I would really focus, as a business community, I'd focus on protecting your consumers right now. They're in a lot of jeopardy, and you can do a lot. Even if the state is not doing a policy, there's rules that you can implement in your own sites or for your own events to protect people. And I think that this is exactly the time that we need to do it very quickly. The more we postpone it, the harder it'll be to have an impact. So I think that'd be my response.
Just want to layer on that a little bit with a question from Laura Edmonds from North Clackamas. Good to see you here, Laura. I hope all is well. Do you foresee another round of business restrictions from this goes to the policy question. So we're going to dial out the aperture. Dr. Grevin, you're talking about this a little bit. Focus on your consumers, focus on your employees, right? Do we see or is there discussions about a new round of business restrictions similar to where we were this time last year or even earlier?
I personally have not. The question, her specific question about what threshold is the governor working from in order to determine whether or not action would be taken. I personally have not heard anything specifically about a threshold mark. As Dr. Graven mentioned, I think that this is an important time for all of us to step up to understanding those basic preventive measures that we've been talking about for 18 months with regard encouraging mask wearing, encouraging physical distancing, encouraging things like hand washing, and now we also have the opportunity for encouraging vaccination. And the more that we can all partner in this effort, the better off we're all serving our community. And particularly in the Portland metro area, but throughout the state, we see that many of the consumers and customers who are actively engaged with the business community are interested in that opportunity for how to protect themselves. And so we appreciate your participation in all of these efforts.
Thank you for that answer. And I think now let's pivot. I see we have a question here from Gail, and this is about, these run, walks, bikes. Some of them, all of us, many of the organizations that are here participate in, events that were probably canceled last year or delayed in some format, these outdoor sort of active events. Are these super spreader events? What should we be doing with them now that we have the new Delta variant out there? An example of the Portland Marathon. What can we do about these outdoor events and these, what should we be recalibrating in terms of, especially on these, clearly they're fundraisers, they're community events, civic entities. So what do we do about these sort of events, and are they super spreaders?
I would say that the decision about that is complicated. Obviously these large gatherings have a lot of priority in terms of business promotion and really lifting the community spirit. And so that's a very difficult decision in terms of gatherings in general. I would say from a clinical medical standpoint that we know large events can be super spreader events. They can lead to clusters and outbreaks of any infectious disease, including COVID-19. So we should really make sure that we are vaccinated, that we wear our masks, and we are physically distanced. I would say that if you're unvaccinated, don't go to these large events because you're going to get yourself sick. And if you're already sick, you could potentially spread it to a lot of people. So these large events, we know scientifically could be a site of infection. There are ways to reduce that risk of super spreaders. But if you're unvaccinated, I would ask that you stay away from those.
Great recommendation. I want to kind of shift back. This goes back to a comment, Dr. Knoll, that you made, I think, in getting on that crystal ball, which is when do children start to get vaccinated? And I see from our friends at Stumptown DJs. So in Oregon, parents that have unvaccinated kids, right? That's a large group of people now. So will those parents be prioritized and considered for the booster when it's released to adults, knowing that this unvaccinated group of kids may be with us for a while just because of approvals and other things like that? So what would be the policy crystal ball you take to the parents with kids who are unvaccinated because of the lack of approvals at this moment?
I mean, there's certainly precedent for that. Certainly Dr. Edwards and I have been very much involved in the decision about vaccine allocation to the community earlier in the pandemic. And the CDC and OHSU did say that parents of children who are medically dependent, disabled, having a lot of devices that they need for survival, those parents and caregivers of those children could be vaccinated early. I don't know what CDC and OHSU will say to that, but I would say that boosters are helpful. But what's really going to keep our kids safe is that people at least get 1 to 2 vaccines themselves. Boosters will help, but if I had a syringe of a vaccine, I'm going to find someone who hasn't been vaccinated. I will give it to them, and before I give it to myself. That's really how we're going to keep our kids safe, is to spread the vaccine love everywhere.
Thank you for that. And I want to pair a couple of questions here, one from Shannon and one from Jeff Miller here in the Q&A. And I think this goes back to this moment in time. We thought we were going to get through this. We thought that we had beaten the pandemic, and here we are again. So what are your recommendations for how businesses looking to verify vaccination with vaccination cards that they check? Is there an app, or what should we be doing? We know that some people have even forged vaccine cards, for goodness sakes. And I pair that with Jeff Miller's question, because he's taking that a little bit further and say, would you suggest that the state implement proof of vaccines for activities, for most activities, maybe those run walks we were just talking about? So how do businesses do it? What would be the best way to do this, or you recommend that they do this? And should we be talking about having a proof of vaccination for activities on a statewide basis?
Even given the fact that, yes, documents can always be forged or made up, if indeed a business is interested in checking someone's vaccination status before they enter a business or partake in an activity, and they're making that choice to check, then I think checking the vaccine card, or a lot of times now, most hospitals and health systems in the area utilize an electronic medical record that often has a patient-facing site within it. At OHSU, it's called MyChart. And so you can pull up your proof of vaccination, for example, if you're an OHSU patient, through your MyChart account. And that's a lovely way, in addition to the vaccine card, or even an app, to be able to verify your status. Is it perfect? No, not all. OHSU's My Chart will be perfect because that again is part of the medical record, but something like a card, yes, people can make the choice to forge that. But I think in large measure, people will be honest. So we're never going to be able to cover all those bases. As far as whether or not we should require this statewide, again, as Dr. Nolt mentioned before, those aren't decisions that OHSU makes on behalf of the state. And I think that we'll leave those kinds of things up to the community feedback, to the governor, to our legislators, to our policymakers who are engaged in those type of decisions for understanding whether or not that's the best choice for Oregon.
Okay, so let's get into something from Randy Miller, who always has a great amount of wisdom. It's not comment on your age, Randy, but it's always good to see you here in the UK and India. The Delta variant rose similar to what is happening here now, and then suddenly dropped off significantly, right? And we saw the modeling earlier. Is that something that could happen here? Is there a way that this could be similar to the way things tracked in UK and in India?
Yeah, I think that's a question for me. You know, the reality is we are racing towards herd immunity, and there is a chance that that is part of what the UK is experiencing. India may be experiencing that in certain areas. But, you know, I know it seems like a nice end to the crisis, but unfortunately, we really have to push that back as far as we can, because right now, if we race towards that, we're not going to have room for the people who get infected to get care for. And so, yes, I think there is a path to herd immunity, and unfortunately, we're on it through infection. What we'd like to do is convert some of those people who are going to get infected to vaccinated people instead. But indeed, you know, this is happening very fast, and you know, that is part of why the curve does begin to go down, is we are infecting so many people right now that, you know, you start running out of them. So yeah, so I would say I know it's easy to look forward to that if you're a person who's vaccinated and feel like you know you want to get to that state, but there's a whole bunch of problems before that we get there.
All right, hopefully we can get one or two more questions in here. So we'll kick this into Tricia, sort of asking the big question, which is, we've got folks who are asking to visit Oregon and interested in coming here, and you know, why is our state experiencing a dramatic surge right now? You know, we thought that Oregon was really doing well against COVID. In fact, we know it was. Actually, we know that the actions we took unequivocally saved lives. So absolutely correct assumption to make. So what happened? How did we get to this point in time? And what do you say back to those folks who are thinking about coming here?
Yeah, here again, I think, you know, the numbers tell the story. Is Oregon has kind of a middle of the road, maybe slightly above average vaccination rate, nothing special. And we have a very low previous infection rate. And those two things combined to a lot of people who are still susceptible. And so when we opened up and right at the time when the Delta variant came, that ended up causing a real problem. Now we were on pace for the right level of immunity, I think, in June, but with the Delta variant, it changed. And unfortunately, you know, that is the story. Oregon, I did produce a thing in middle of July showing that Oregon was one of the highest risk states for an outbreak because our immunity level was so low relative to what it needed to be for the Delta variant. So some of this is predictable. I wish, you know, I didn't have all this predicted, I'll tell you that. And unfortunately, now we're in a spot where we have to respond. And like I said, I think, you know, it's every day is a crisis right now. When I look at the numbers, and the numbers to me are very real, you can tell it's a crisis. So, and, you know, to the point, you know, people coming here, yeah, I think that's what's happened. You know, it's happening all around the country. You know, very few places were prepared for this level of immunity. The Northeast, I think I pointed out in this slide, is probably the one that's the closest. Although you're still seeing cases go up there, you're still seeing some hospitalizations and stuff. So no one's really fully protected, but we just needed a higher vaccination rate in order to take on these new level of encounters.
All right, so I think we have time for one more. It's coming from Shannon. I think this is kind of interesting. I think everyone's had this moment where, so she's asking the question, many people I know have gotten ill lately and all have tested negative for COVID. So are you seeing spikes in flus or colds? And I say that because I think everyone's maybe at one point in time had the sniffles, like, oh no, I've got COVID, and rushed off and had a negative test or hopefully a negative test. So what are you seeing in terms of, last year, the flu season, really was not present because of the amazing amount of distance we had and restrictions. So what are you seeing for the standard flus or the colds or the things that might be popping up? Is that increasing or staying the same, or what's the analysis there?
Well, right now, I guess I'll take that one. Because I just checked the CDC and OHN. We don't have any flu right now, and we don't have any RSV. So I think that if you're using your mask, your risk of getting a respiratory virus is very, very low. I can't say what it could be in any particular situation. I do commend you that if you feel like you're ill, that you stayed home and got tested. That is great. Do that. I had a tickle about a week and a half ago, and I just went and got tested because that's the big game around. And so I think we should continue to stress that if you feel ill, even if you're vaccinated, and particularly if you're not, please isolate yourself and get tested.
It's a great way to end things. I think the good news for all of us is that the recommendations we've been making for so long are still in place. They're still relevant: masking, distance, vaccine. So if you haven't gotten your vaccine, get it, of course. And I just have to say thank you to this esteemed panel first for taking the time out of your busy days. We know that you have been shouldering a lot, and we appreciate the service of OHSU, who's done more than just be a hospital for the region, but has also provided the state immeasurable competencies in terms of our policy work and our medical response. And I also know that your staffs are strained, and that you have been working beyond the normal call of duty. So from all of us in the business community and beyond, who will look back on this time, we will remember it and we appreciate it. And thank you to your staffs, who I know are also under that same stress. So our gratitude to all of you on behalf of the Travel Portland community, and of course, our Oregon Restaurant Lodging Association friends, thank you so much for being here today. And just on that note, to all of the members of the Portland Business Alliance, thanks for joining us, and all our extended friends and family from our other associations, thanks so much for being here. We will be back virtually on September 15th, actually on a forum to discuss the incredible tight labor market that is happening across all industries. And I know the medical community most impacted in many ways. So we hope to see you back here on the 15th of September at 10 a.m. I'll circulate that into the chat function. Everybody else, stay safe, be well. Good luck out there, and take care. Bye-bye.